What if stress isn't just affecting your mind, but quietly damaging your gut every single day? Most men think of stress as mental pressure, but biologically, stress changes how your body functions at the deepest level, and one of the first systems it disrupts is your gut. And the part most men don't realize is that this process happens quietly, without immediate symptoms, until it compounds. As a clinical pharmacist in my practice, I notice fatigue, digestive issues, and hormonal concerns are some of the most common complaints men bring up, often without a clear explanation, and very often, chronic stress is part of that picture. When men think about stress, they usually focus on workload, deadlines, responsibilities, but stress is not just something you feel. It is something your body responds to. Immediately. Every time your brain perceives stress, your body shifts into a different mode, a survival mode. And in that state, certain systems are prioritized, while others are suppressed. Digestion is one of the first systems to be affected. Blood flow is redirected. Enzymatic activity changes. The entire digestive environment becomes less efficient, not because something is broken, but because the body is prioritizing survival. Because from a biological perspective, survival always comes before repair. The stress response activates a hormonal cascade centered around cortisol. Cortisol is not inherently harmful. It is designed to help you respond to challenges. But when stress becomes chronic, cortisol levels remain elevated longer than intended, and that begins to affect the gut, specifically the integrity of the gut barrier. The intestinal lining functions as a protective filter, regulating what enters the bloodstream and what stays contained. Under chronic stress, this barrier can become less stable. The tight junctions between cells begin to loosen. This change is subtle at first. It does not create immediate discomfort, but it alters how the gut regulates what enters the body, and over time, that regulation becomes less precise. And when that happens, the gut becomes more permeable. As permeability increases, substances that are normally contained can begin to pass into circulation. The immune system recognizes these as foreign. This response creates inflammation, and this type of inflammation is not always visible. It operates in the background, influencing how systems communicate, day after day. Not the kind you feel immediately, but a low-grade, persistent signal that affects the entire body. Over time, this inflammatory environment changes how systems communicate, including energy regulation, hormonal signaling, and recovery. Stress does not stay in the mind, it becomes biological. When the gut barrier is compromised and inflammation rises, multiple systems begin to shift. Energy becomes less stable, not necessarily lower, but less consistent. Hormonal signaling becomes less efficient. Recovery takes longer than expected, and mental clarity requires more effort to maintain. These changes do not happen all at once. They develop gradually, which is why they are often overlooked. But the underlying pattern is consistent. When stress remains unaddressed, the body stays in a state of internal pressure. What men often notice is not a single symptom, but a pattern. Is not intensity, but inconsistency. Good days followed by low days. Energy that feels unpredictable. Energy that fluctuates throughout the day. Focus that fades earlier than expected. Slower recovery after physical effort. Increased sensitivity to stress. These changes are subtle, but they are consistent, and over time, they begin to feel normal. Even though they are not, that normalization is what makes the pattern easy to ignore. The encouraging part is this: the body is responsive. The gut barrier can stabilize, inflammatory signals can decrease, systems can rebalance, but only when the internal environment becomes stable again. Stability is what allows repair to begin. But this does not happen instantly. It happens as conditions improve, as the body shifts from survival mode back to regulation, back to repair. From a clinical perspective, chronic stress is often an overlooked driver of gut dysfunction. Not because it is invisible, but because it is normalized. Sustainable improvement does not come from addressing symptoms alone. It comes from understanding the conditions influencing the system, and stress is one of the most powerful of those conditions. The body responds to the environment it is given, and this is where many approaches fall short. They focus on symptoms, instead of the conditions driving them. This was episode 6 of the ManBiome series. In the next episode, we'll explore a common mistake many men make when trying to improve gut health, and why fiber, when misunderstood, can work against you instead of for you. Subscribe and enable notifications to continue the ManBiome series. Each episode builds on the last. Continue to episode 7, the fiber mistake most men make. Rebuild from the gut up. The information shared in this video is for educational purposes only. Always consult your healthcare provider regarding your individual needs.